Awesome. Well, good afternoon and happy Friday, everyone. And welcome to today's webinar. We're thrilled to have you all with us as we explore the impact of test automation and how it can drive efficiency and reduce risk for your organization. First, a warm welcome to all of our attendees and a special thank you to Frankie and Chad from our strategic partner, Keysight. SureTest is proud to partner with Keysight, and we've been very intentional in selecting their product as a key component of our automation solution. I also want to express our gratitude to our incredible partners at Novant Health. Our collaboration has been instrumental in driving innovation and excellence, and today we're honored to be joined by two outstanding leaders who have played a key role in that success. Joining us is Ryan Neaves, VP of Care Applications. Ryan brings a wealth of experience in optimizing healthcare technology to enhance patient outcomes and streamline operations. His leadership has been pivotal in advancing digital transformation across Novant Health. Also with us is Myron Coulson, Senior Director of Digital Products and Services. Myron's strategic approach to digital innovation has strengthened Novant Health's digital ecosystem, ensuring a seamless experience for both providers and patients. Ryan and Myron, thank you both for being here today and for your continued partnership. We look forward to hearing your insights. And with that, let's dive in. So the topics for the agenda today are, of course, Novant's test automation journey and some tips and tricks, best practices, lessons learned. We'll leave some time for Q&A at the end of Myron and Ryan's presentation. We'll also, of course, cover SureManage, which is our test automation solution. And then we have an ROI calculator that we've prepared that'll really help you capture not only the manual testing activities and the resources that are associated with that, and the overall time that you're spending performing manual test activities, but the comparison of what automation can deliver in terms of ROI. If I could ask everyone to please share any questions you have in the questions queue rather than the chat queue, we'll field those as appropriate and share those with Ryan and Myron. So Ryan, Myron, I'll turn it over to you.
Excellent. Thank you, Philip. We appreciate that partnership that you had mentioned as well. Really, so the idea behind this webinar today is, we talked to Philip about this as well, is, it's not to be that, some sales mechanism or something like that. Really what we're hoping to do is just talk to other folks that are kind of probably on the same journey that we were on a number of years ago, and just talk through kind of what are the pitfalls that we saw as we went through the journey. And really it's just to kind of share what we were able to discover with SureTest as we went down that journey as well. But just a little bit about us. We are a 19-facility healthcare system. We cover North Carolina, South Carolina, and we've grown very rapidly over the last few years as well. And so, we're anticipating we're probably going to move into some other states over time as well. But having said that, around 700 or 750 ambulatory locations as well. And we've got kind of, we cover the gamut in terms of specialties, in terms of size of facility. We've got a little bit of everything. We also have a slide, next slide, please. We also have we always put together this kind of marketing slide, if you will, that just kind of shows, here's Novant Health by the numbers. I'm not going to drain this slide, but I'll just call out, we're 6.8 million ambulatory visits a year. We see over 150,000 inpatients a year. And the other thing I'll call out is we have a very strong MyChart user base, 2.5 million users. If we had our entire MyChart user base in the same place at the same time, it'd be the 4th largest city in the United States. And we're coming close to Chicago, so we're hoping to close that gap on that in the next couple of years as well. Next slide, please. All right, so let's talk a little bit about our journey and what kind of necessitated the partnership that we now have with SureTest. And really it's around 2018, 19, we saw a shift in the way that Epic, our primary vendor from an EHR standpoint, in the way that they were delivering their products. And so pre-2018, it was really a yearly cycle, if you will. So you were taking one big upgrade every year. Most organizations at least were. We definitely were. We were one of those that was taking one large upgrade a year. And Epic made the decision that they wanted to move into a quarterly release cycle. And so with that, we were seeing that placed a lot more burden on the testing piece, if you will. Instead of having these one large event per year. You were really having 4 medium to large events every year. And so we were seeing a lot more burden on the testing. We were seeing a lot more burden on the teams themselves to be involved in the testing as well. And then we just kind of saw in general that as our environment became more complicated, we had a need that we needed to just test more and more. And so we kind of did an assessment, and we looked at across our entire organization, and we looked for just a strategic partner that we could partner with in order to try to solve for this. We were spending around 20 to 22,000 hours annually on manual testing activities, and we had a dedicated QA staff. The next slide, please. Which was about 20 people or so, 20 to 25 people that were really just only involved in Epic testing events. And so we were finding that was quite an expense that we were really racking up over time, and that we had 20, 25 folks that were always involved in testing every single day. That was getting the job done, don't get me wrong. But what we were finding is, even if you were able to, even if we had this staff, this dedicated QA staff, even if they were able to complete their jobs and test all this different functionality, there were kind of 2 different issues that we saw. Number one, you're really only running a test script once, twice, maybe 3 times at the most. And then number 2, we were still seeing our analysts were getting pulled into these testing events. And one of the main things that we brought to SureTest, as well as several other vendors, by the way, as we did kind of an RFP process for this, was that what can you do to ensure that our analysts are not pulled into all these testing events, because we want them spending their time doing the things that are going to bring the most value to our organization, which is building an Epic and really kind of building in the application that they're assigned, if you will. We had tried a couple times to launch automated testing softwares without success. We'd selected a couple different products to try in the space itself. We had at one point we had purchased a software, and we thought we would train this QA staff to be able to kind of automate or kind of use the software itself. We were not successful in that. And so we had reached out to SureTest, as well as, like I say, these other vendors, but SureTest is obviously who won our business. And they were able to develop a program that allowed us to lean on their expertise, not only in the automation software, if you will, but also they were able to give us knowledgeable folks that knew about Epic, that knew about kind of the build elements that the Epic entailed, and were very aware of just how far-reaching the Epic space is, if you will. Next slide. And what you're going to see here, and I'll let Myron kind of talk through the numbers that you're seeing here on this slide, but what you're going to see is we kind of started off, when we started off, it was in person. We kind of build this to our staff as, come and run these scripts one more time and you won't have to run them again. And that was really the way that we got our folks engaged on this. And we just had a big boardroom where we had folks come through, and we had our team leads for ASAP and for Uptime and for all the different applications go through and perform the script end to end. And then we sat with SureTest, and they captured those scripts as we went. And so initially it was an in-person. We didn't have a lot of those scripts to start off with, but it grew pretty rapidly after that. And I know Myron he's on. Myron kind of is really our primary in terms of the relationship with SureTest at this point. But Myron's going to kind of talk through exactly how the program grew from there.
Hey, thanks, Ryan. Good afternoon, everybody. Again, my name is Myron Coulson, and I am the Senior Director of Clinical Applications at Novant Health. All of my teams are the Epic inpatient teams, and I also have lab, and I've dealt with oncology and research in the past as well, and radiology. But as Ryan said, SureTest, when we first had our relationship with them, they came on site, they brought 3 or 4 people. and they were there for a number of weeks in a big conference room where we had the different teams come in, like Beacon would come in, and we would go through all of our scripts with SureTest until they had them down in their environment where they felt like they could run them on their own. And occasionally they'd reach out to the analysts. But after that, it shifted to remote, and we have one dedicated SureTest analyst who does have an Epic background, was Epic certified at one time, and completely controls all of our automated testing. Now, he does have backups within SureTest that come in occasionally. Obviously, he has to go on PTO or take days off, whatever. But they have 2 or 3 people that are also familiar with our environment in case we need them, or he has to go work on something else. But he is in our system a lot, and I have a biweekly meeting with him where all of the application managers have the option to come in and speak to him about any of their scripts or new scripts that they want, or anything that they're seeing with testing or special testing. And then our Epic program director also meets with him on that same meeting and talks about upcoming upgrades, mergers and acquisitions that are on the horizon. And this SureTest analyst also participates in all of our Novant sessions and has full access to Epic User Web, where they're listening to the teams go through the notes and talk about what they're taking for the upgrade, what they're not taking, automated, whatever. And he's taking note of all of that and adjusting all of his scripts accordingly. So they stay pretty well in sync with our Epic environment. And what you're seeing here on the screen is I had, I went back with him a few years and looked at how many scripts we had and how we grew our script library up to have 425 at this time. And the reason it doubled in 2024 is we had a huge acquisition of a coastal healthcare system, New Hanover Medical, that was a 900-bed hospital that was coming off their instance of Epic and coming on to ours, our enterprise build. And we had to obviously test that build, and we doubled up scripts just for that environment, and while we were running scripts on our production environment at the same time. So he does have the ability to point these test scripts to any one of our environments, whether we upgrade our non-prods in preparation for build for an upgrade. He can start testing on that as well as keep testing in the production environment for any moves or SUs or anything break fix that's going on there. So it is a pretty robust testing environment. It runs on Eggplant software, and it runs on servers in our environment. And my teams don't have anything to do with the server. So that's huge. I mean, they don't have to support it. They don't have to do incident ticket response or anything to it. So it's totally supported by SureTest, sorry. And then this little snapshot you're seeing at the bottom is an actual audit log captured from running a test in our environment, running a script in our environment. And we had them, we stood up on Microsoft Teams site and had the SureTest analysts keep dumping these nightly logs in there because we were getting questions from internal audit about what we were doing for testing to support SUs and specific Epic changes that were going on. And they weren't satisfied with our, well, we have a Sherlock out there, and they just, they wanted documentation. So we started supplying these logs to them, giving them access to when they can go in there and look it up whenever they want. And that seemed to satisfy them. Of course, they're always asking for a little bit more detail, and we're continuing to work on that. But for now, I think it does fill that gap with internal audit for documentation around Epic testing. Next slide. What do we got? Yeah, so I talked briefly about the New Hanover acquisition, and this is the Epic conversion project. It required obviously new build to accommodate unique workflows. And we leveraged the existing script library that we'd always been running because we knew that they were coming onto our enterprise build, but we had a unique build to support that hospital. They had departments we didn't have, obviously stuff like that. So that's why we doubled those scripts up and started modifying them to meet the what would be the new enterprise build with that healthcare system on board. And then, yeah, during the go or the prep for that go live, the analysts were heads down, just under the time clock all the time, trying to meet deadlines. I can't imagine what that would have done to the teams if we had to break them away to do testing when we knew that that was already taken care of. Now, obviously, they still did some testing. There's third-party applications that are, integrated into Epic that we haven't yet built scripts for, but we are starting to explore that third-party application area. Blood bank specifically right now we're looking at. So I will just tell you that during that go live, which was a huge go live, we were on site for 3 weeks supporting the go live. We had 10,000 incident tickets come into the support center that were tagged for the go live related incidents. And we know of other healthcare systems that are like us, about the same size, that have done similar Epic to Epic conversions, and they've had 3 times. Now, can I attribute that all to SureTest? Probably not, but I can tell you that it did cut down probably on a number of incident tickets that were caught during testing. And I think I briefly touched on upgrade. I talked about how they sit in our Novant sessions and they use user web to do research on their own. They do reach out to our analysts for explanation on certain build. But for the most part, they're pretty self-contained and they just go on their own, and we touch base with them every 2 weeks and they reach out if they need something. And then that leaves our teams to focus on build, and they're not pulled into a lot of testing. And like I said earlier, they can be pointed to a number of different environments, and this is helpful when non-prod's upgraded. What do we have next? Yeah, so I think I just jotted down some feedback, from our different teams. A noticeable reduction in incident tickets. They have more time to build. Our program manager likes to meet with our SureTest analysts regularly, checking on progress and bring up new unique things. If we're bringing on a new Epic module, we brought up genomics at one time and we had them plugged into that project. So they're always aware, so we don't lose sight of our testing efforts. And now I said we were extending to third-party application testing. The analysts have really become accustomed to not having to test. And, let's face it, analysts get paid pretty well, and it's kind of a waste of their resource to have them sitting there running a test script. So we feel like we're getting our value out of it there. And go ahead, Ryan.
I would echo exactly what you said as well, Myron. I think some of the key benefits that we were able to recognize kind of right off the bat is we do not have that dedicated QA team anymore that I spoke of earlier. We have, we reallocated those folks to other areas or eliminated those positions. And it was one of those things where that's immediately, it was one of those things where we saw the immediate benefit that allowed us to do that. The other thing that I'll say is, even as I had mentioned before, in that manual testing cycle that we were in, we were at, best case scenario, testing a piece of functionality, 3 times in kind of a formal fashion. And now we actually have these scripts that just run at a certain time every single night. And it's become one of those things where, it becomes anecdotal to a point, but I mean, we're tracking these things over time too, where we're just discovering issues that maybe you wouldn't see unless you ran a script the 5th time, or it's items like that are popping up in terms of especially upgrades and things of that nature, where you got new build that's coming in. So those are some of the anecdotal things that we've seen, but I would also just call out the fact that I think, as Myron mentioned, the team itself just feels like that's just something they don't have to worry about, and they don't have to worry about, it used to be this almost kind of this drudgery, if you will, with our teams, where they knew if there was an audit, if there was a testing event that was happening that day, they need to stay by their phone and they need to be available to go and sit in the room and run those scripts. And so it is one of those things where I think it's helped overall team morale, in addition to us seeing the benefits of just being able to hand off this entire book of business, if you will, in terms of Epic testing, over to SureTest to kind of help us and partner with us there. One of the things that Myron did mention is third party. So we are exploring that currently right now. We're looking at blood bank, we're looking at PACS, we're looking at some of these other areas as well. We have not ventured into that area yet, but that is something that I know that SureTest has that capability there. And Philip, that might actually be a good segue if you want to just kind of speak on, what are some of the third-party opportunities that SureTest can offer as well?
Yeah, you bet. Gayla, do you want to move on to the third-party slide? So today, these are what we like to refer to as the common automations that we've captured and have in our global de-identified library across all the customers that we have today. So if you see a third-party application or another application, enterprise application that's not mentioned here, it's not that we can't automate testing for it. It's just simply somebody hasn't asked us to do so yet. And so if you can access a test environment, you can give us access to a test environment, you test it with a keyboard and mouse, we can complete the round trips for you. So no, that's a great point. We are actively in discussions, and we have done some automation around ERPs, but our thought process was this: the EMRs tend to have the most complexity around a full integrated journey. And so we built a methodology that we felt would be very transferable. Granted, we were successful in the EMR space, and we have been transferable to other enterprise applications such as the ERPs. And so Workday, Oracle Fusion, Infor, all the major ERPs that are leveraged throughout healthcare today are definitely expansion opportunities that we are actively in discussions with our current partners. And a couple of notes, in terms of, Myron, Ryan, first and foremost, greatly appreciate your time today, and very grateful for the partnership that we've been able to establish over almost nearly 8 years at this point, I believe it's been. And Novant, in full disclosure, was our first customer. So, certainly owe a lot of the success that we've had to you all giving us the opportunity to partner with you in the first place. And we would, as you would imagine, have matured our processes pretty significantly since our first automation program. So, as an example, what Myron and Ryan were referring to is the workflow capture process. What we found is the best way to do that is to capture that over a bridge line or a conference session that we record. The reason for that is there's inherently something that an analyst will do throughout the testing process that is, institutional knowledge, or it's just subconscious. They're looking for a green screen, and that's not necessarily documented. So what we'll do is we'll have our team of engineers who we've been very intentional about focusing on healthcare workflow and Epic, previous Epic certified analysts who can who have been in that analyst position. So they have a lot of knowledge around those three areas of those domains. And when they do, so when we manage your environment and we're updating those test scripts on your behalf, and we're continuously, the continuous development that's going on, that's how we're able to make the appropriate adjustments without having to constantly ping the analyst on the customer side of the house and say, hey, I saw the test script broke. How should we fix this? No, it's not that we just essentially found a problem. It's, hey, we found the problem, we know the solution, we just want to validate that the solution that we have in mind, the remediation we have in mind, is accurate. So that's being able to take that responsibility off of their analysts so that they can focus on initiatives that are really more impactful for the organization is the goal. So I do want to leave some time for questions and answers. If anybody on the line does have questions, be more than happy to field those and facilitate the discussion. I think we may have lost Gayla. Well, Ryan, Myron, I think we may have some technical difficulties. I just got a text from Gayla. We may have to come back to Q&A, so I apologize. But as an example of that workflow capture and deployment, our average is about 6 months. It can range anywhere from 6 to 9 months to deploy a full automation program. And when you think about automation, just in general, a couple of things to keep in mind. We're not just talking about the hands-on keyboards testing. So the prerequisites of creating a patient, registering that patient, rooming the patient, and then the full integrated journey that takes place. Those are all key components that we take ownership of as well. I think one other piece that's been kind of hard to benchmark is the fact that the proactive capturing or the proactive identification of any issues that we prevent from going into production. That's a big time. You think about the ripple effect across an organization as something does hit production. So, as an example, we had a customer who made some updates to an order set and essentially didn't appropriate the charge codes to that order set, and we caught that before it went into production. So that's one key example of how we would capture that proactively. And then to kind of come back to the full deployment cycle, we've gotten really fast at our ability to deploy. We recently engaged Cook Children's, and so we started their workflow capture on December 9th, and by January 31st, we had completely developed all of their scripts. So just in 2 months' time, we were able to do that, and it's hard to believe that you can have an analyst only commit a small portion of time, only a few hours, to our deployment, which we try to be very mindful about the requests from your end, knowing that most of the teams that you're allocating to us are probably already over capacity. So with that workflow capture and then deployment being 2.5 months to get to that full deployment in preparation of being able to really support their upcoming testing event in March, that's a new record for us. So pretty excited about that. The slide that we have up now is a representation of what we've captured collectively across the customers and prospects that we've worked with. And we tend to see we've taken the highs and thrown those out, and we've taken the lows and thrown those out. So these are really the averages that we've seen. In most cases, you have anywhere from 13 to 36 resources that participate in manual testing activities in those testing events that we've highlighted in different capacities. And it takes, if anybody, organizations look to stand up their own automation program, that can take 3 years with 5 fully dedicated resources. And to, I think it was Ryan's point, it is a cumbersome task. And I think the thing that's probably most underestimated is maintaining that accurate library and being able to dedicate resources to doing that. So a lot of the organizations we've seen look to leverage Eggplant, which is, if you're unfamiliar with Keysight, Eggplant is owned by Keysight, and that's the automation solution that is integrated within our platform. Our differentiators are our frameworks, which really allow us to scale a program, but then also maintain that accurate library on your behalf. An analogy I've heard Mark use, Mark is our COO, is it's like trying to paint the Golden Gate Bridge. By the time you're done painting the bridge, you get to the other side, it's time to restart on the other side. There's so much that goes into it. And we tend to, as the continuous development goes on, we tend to turn your library over completely in a year just because of the number of changes that are taking place within that environment. So it's a large lift and even more so to keep it up to date. Manual testing activities over 3 years, the average we've seen is about $4.2 million. Our solution is a fraction of that cost. We, on average, are giving back anywhere between 18 and 22,000 hours. So it's roughly 9.5 FTEs on an annual basis that are reallocated to more strategic initiatives. And then usable automation is available usually within about 4 to 5 weeks. It can vary by project. So I like to say in the first couple of months, but we are getting faster and faster at our deployment. So the time to value is becoming much shorter. And then our average ROI across 3 years is 244%. We're seeing anywhere between 80 and 100% over year one. And it looks like we do have some questions. So Gail, I'm unable to see those. If you want to share those with me, either via text or through Teams, and I can facilitate. while she's pulling that up, again, what makes our solution unique is, you've heard eggplant a number of times. Eggplant is, again, we scoured the market initially looking for a solution that we felt would be best to support our healthcare customers. So we are unique to healthcare. We're Keysight's premier partner in the healthcare space, and our frameworks that sit on top of eggplant not only allow us to deploy that solution, but the way that we look at automation and reusability around automation is where we ensure our customers get the most value. And those frameworks that we've developed allow us to, when we manage your library, allow us to propagate any changes that we make across your library in kind of one update, if you will. So that's another key component of our frameworks there, and our differentiators, if you will. Gayla, if you want to...
I'm sorry, the question is the expectation that only larger Epic upgrades are tested by SureTest, or would this include smaller build projects and application enhancements?
Great question.
Yeah, I'm happy to speak to that. We use it for all. So we called out upgrades, of course, just because that was kind of that was really kind of the genesis for a lot of the journey itself. But we use it for SUs. We use it for all of the kind of small enhancements, new module rollouts, what have you. We use it for any and all of the kind of Epic space, as it were. Myron, I don't know anything you would add there.
Yeah, we're also starting to look at it for third-party targeting testing, like I was speaking about earlier with blood bank. We have a pretty good blood bank project going on. We have 2 different blood bank systems in our environment, and we're actually looking at potentially going to 1. So we're starting to look at testing blood bank very specific in that area. So it would just be 1 hospital at a time kind of thing to look at that.
And the other question is just a test question. I think they were trying to help us out. Thank you.
Excellent. Well, that's if we have additional questions pop up, Ryan, Myron, I'll be happy to field those, and we can continue through the presentation. So again, kind of highlighting the solution, SureManage, as we referred to it earlier. In the middle there are our frameworks we talked about, which are our differentiators. This is what uniquely allows us to really maintain an accurate library on your behalf. As we look at SureWorks, the library, this is our global de-identified library that we've captured. And today we have about 3,500 common automations that allow us to expedite your deployment. And there's a community knowledge there as well. There's a benefit from that perspective. But when you look at, in terms of expediting your deployment, as we look to capture workflows from your organization, we can bounce those workflows off our global de-identified library and say, who's most like your organization, and the organization that has the most commonality to yours. We can then take some of that reusability, apply it to your organization, and then develop anything that's specific to your organization for you. So we get about a 60 to 70% jump on net new development. And then the Sure Persona engine is your specific library that we create for you, your own tenant. And then outside of that, of course, is that continuous development. So as we're preparing for an upcoming major testing event, your upgrades, we're ensuring that environment is clean, prepped, ready, and therefore it becomes somewhat of a non-event. And then to the question and Ryan's point that we just talked through, they're leveraging it for SUs and the regression testing that we're doing on a continuous basis. So we'll turn your library over in terms of actually running your scripts at least once a month. So there's and likely more often than that, but we commit to at least running your test scripts once a month. And we found a lot of benefit to that because we're catching issues before they are making their way into production. And we'll talk a bit more about that as we get into the ROI calculator. So it looks like we do have another question. How many manual testing hours does a health system need to be spending to realize a SureTest ROI? Again, we have customers anywhere from 13 analysts that are dedicated to testing, and anywhere from, I'd say, 10,000 hours up to 35,000 hours is what we've seen. And so there's more benefit than just the tangible dollars, I would say. You get an increased morale or employee satisfaction, because you're really empowering your analysts to practice at the top of their license and stay dedicated to those high value tasks. In addition to that, there's an inherent risk to not testing at the level of rigor that you likely should. So catching those issues before you go into production. And we continue to look at ways that we can capture this, but that's the piece at the end where those production issues arise because testing wasn't necessarily performed in the capacity it should have been, and the impact that it has across the organization, the impact it has on IT in terms of level of trust. So I think there's that component as well. And we've actually had a lot of customers use it as a talent attractor, right? So they look to attract talent from an Epic perspective and say you'll never have to test again in the capacity you have in the past, and then also retain that talent. So there's a lot more to the ROI conversation than just the dollars. So that was got another question. So could you talk more about the managed automation and what that means on the SureTest side? Are there human SureTest analysts running a step-by-step script in one of our Epic and test environments? Would this mean the SureTest analysts need to access our Epic instance? So great question. Our server is installed behind your firewall on your TST environment. And so we do have, you would need to set up the appropriate credentials for our team to come in, but we are only accessing your test environment. And we develop the script. Once we capture your workflow, that becomes our design document. And that design document goes through our tool set and development. At that point, we release that into production, and that's an iterative process, so we're not holding back any automation throughout the deployment process. Therefore, you all are receiving that value from that automation. So it is technology running the scripts on your behalf. It is not an analyst that is running that. From a managed service perspective, again, we own the testing process, integrated testing and regression testing process. So as we are monitoring your test scripts as they're being run. As we identify an error, if one does occur, we will look to remediate that error on your behalf and strictly update the script in the test environment. We will never touch your production environment. When we do make an update, we'll reach out to our liaison on the customer side and say, hey, we noticed that there was an impact to the test script. We've made the appropriate change to that test script based on the change we see in production. And we want to ensure that the remediation we made is accurate. Was this the intended change? And 98% of the time, we're right. If we do identify an issue in production, we will provide documentation that shows what issue was found. Therefore, you all can make the appropriate remediation on your side, which does expedite that process. The analysts no longer have to hunt and peck and find and try to recreate that issue. We've done that for you. Again, kind of taking the headache and the previous burden of testing off the analyst's hands.
Yeah, and I would just add, Philip, I mean, the day-to-day, the way that looks to us is that we're just having our regular meetings with our assigned analysts from a SureTest perspective. So we have kind of a testing, director, I'll call them, that we meet with them every single week. And really what it looks like is we're, if we've got an upcoming change that we're wanting to put into our, our production environment or what have you, that's going to have an impact on overall testing scripts, we pull them in on that change. Whenever we're doing an upgrade, for example, we have a series of Novant review sessions where we actually still bring together all the team leads together to talk through interdependencies and things like that. SureTest sits in on that meeting. And they take notes, and then basically they're walking out of that room with the list of updates that they feel like needs to be made to the script itself. And so, but yes, they do. They have access to our lower environments, and they're able to get in there. But just from a just from a kind of a testing perspective, because as soon as it's captured, as soon as we make those folks aware, they update the scripts themselves, and then it's just automated. And so it may be running 2-3 times a day.
Yeah, I'll just add that we onboarded those SureTest analysts like any other contractor, and they have Novant credentials, just like we would treat any other contractor. And we attest their access every 6 months according to our policy. But they just, have remote access like anybody else would. And like Ryan said, they attend meetings, and we've really integrated them into the Epic team. So they're kind of just part of the Epic team.
It's a great point. I appreciate the additional color on that, and it actually answered one of the questions that had come through. And so, what we look to do is we truly look to become a collaborative partner throughout the process and become a party to your change control. And as we get integrated in that process, and as we're preparing for a major testing event, our team is sitting in with your team, really looking to understand what changes you're taking from those Nova notes and those updates or releases. And at that point, we're working with you to ensure that we're capturing those updates appropriately in the test environment. So great point, and thank you all for calling it out. One thing I want to jump back to real quick is we talked about, Ryan, Myron, you all had a testing team that was dedicated to Novant. And I think, in today's environment, there are a lot of organizations who are looking to do more with less, and they are their teams are maxed out or working at capacity or above. So I think there's a lot of opportunity to either upskill or cross-train and allow those individuals to move on to other roles that are supportive of really the initiatives you have in flight. Can you share a little bit about how that worked at Novant?
Yeah, for sure. I mean, we had, as I mentioned, we had a dedicated test group, a dedicated QA group, and what we did is even with that dedicated group, and I don't know if that's the same for all organizations or if it was just us, we were still seeing analysts were being pulled into the testing events, and a lot of that has to do with the fact that our analysts that we had from a QA perspective they weren't necessarily experts in Epic. They didn't know every single module. They were experts in QA, and testing. And so if you gave them the steps on what should happen, they would follow that. But because of that, what you would see is you maybe would have a result that you expected. But in Epic, you can access that same result 2 or 3 different pathways. And so as test scripts would be run or what have you, we would find that, we have analysts that are getting pulled in. Hey, we're getting this result. This doesn't feel right. What's happening here? And then it would be this tremendous back and forth. And so what we've been able to do is we've been able to really, through the automation itself, our analysts are only ever, they're only ever just engaged in the build work now. So they're building things out. If there's a result that's unexpected that comes up, it really becomes the type of thing where it's a quick IM or a quick email over to say, hey, we're getting a result we don't expect, and it's caught in a lower environment before it gets to the production environment. And so it's one of those things where it's just it's an open conversation that happens. We're not seeing the need to pull these analysts in because the results are consistent with what's been captured. So it's not I would just say, overall, the way that process kind of played out for us was we started seeing immediate benefits from that. And then we just saw we were able to then, justify the fact that we could lean on SureTest instead of having a dedicated QA team that was always testing in the environment. And so we just kind of systematically kind of operated and eliminated that as an arm of IT, if you will, that entire QA group, just knowing that we could lean on the solution itself. And again, we were able to reallocate, basically all those folks to other positions. But it was one of those things where that was really the reason why we wanted to take this on to start with, was just to create efficiencies as we went. And so that was kind of how we operated.
Yeah, I'll just add that, that QA team, I think at first it worked out, but as we continued to evolve and it got more complicated in the environment, that team seemed to have a lot of turnover. That's kind of an entry level position, and people would come and go, or they would find another opportunity and move on. So it seemed like they were in a constant state of training and retraining people to understand the scripts in the environment and how to run a script and whatever. But yeah, I mean, since moving to SureTest and stabilizing that environment, I mean, we don't see any of that anymore. It's been a number of years. We haven't even thought about it, but like Ryan said, most of those folks moved on to other opportunities, or they just moved outside the organization.
That's helpful, and that's the goal, right? We want to be out of sight, out of mind. So glad to hear that's the experience, and things are they're no longer a burden for you in terms of testing, right? And it's kind of your mind's at ease. And to jump back to, I know I'm kind of jumping back and forth in terms of the conversation here, but in terms of the upgrades or how we would partner with you to ensure that we're capturing any of those updates that are being made to the environment. Like it would be, in a perfect world, amazing if we knew about everything that was happening in the environment proactively. But we just know that that's not a reality. And so one of the benefits of us running your test scripts on a continuous basis is that even if we're not made aware of a change, we're going to pick up on that change. It's going to impact the script, and then therefore we're going to know. And essentially, again, we make that update on your behalf, and we continue to move on, right? So it becomes somewhat of a non-issue. And if we get to a major event, we use a combination of attended and unattended test runs. We know how critical those major events are. So it's important that we maintain development ongoing to keep your scripts up to date, but we certainly are involved throughout the process in those major testing events. So really turnkey. And one, to the community benefit, right, too, is we've got a few customers who are just on the bleeding edge. And so as we get to major events like going to hyperdrive, we've never had to pull analysts back in for major events like that because it was something that we haven't seen before. So there is a community benefit like that. If we find out there are potential risks or a potential gap in knowledge, we'll share that information proactively with our partners so that they can make the appropriate adjustments on their side.
Yeah, and I'll just say, I think we're like a lot of Epic customers. We try to stay about 6 months removed from being on that bleeding edge, just because we were in that space for a while. Right now we're in kind of a catch-up mode, just because we had a lot of acquisitions that have kind of put us behind just a little bit. But in general, we like to stay 1 to 2 versions behind where Epic is at any given moment, and that just gives us the comfort of knowing that. But having said that, we've still found issues. Even at 6 months removed, we sometimes find that we're the largest organization that's going live with a given upgrade or something like that, and it's only at volume that you sometimes find some of these coding issues. And so we found a number of issues, utilizing SureTest, where we've reported back to Epic to say, hey, we found this issue, and it was only whenever we had 30,000 machines running on the same environment. And so that's been something that we have discovered as we've gone, especially in that upgrade process, where we'll discover some bugs like that every now and then. It gives you that confidence to be able to go back to Epic to say, hey, we didn't just find it once. We reran the script 50 times, and every single time it presented. So yeah, something else we were able to kind of hopefully troubleshoot for some other organizations too.
Absolutely, you certainly have. I know we're at about 10 minutes left, so quick time check. If there are any other questions from the group, I'm more than happy to field those quickly and allow Ryan and Myron to answer. Gayla, while we're doing that, do you want to pull the ROI calculator up, and we can just walk through that quickly? So this is the, part of the important thing, right, is we need to be, as we know, a solution that you may be evaluating, we need to be able to articulate what is the ROI associated with this solution that we're evaluating. So as, as a part of that, what we did was we developed an ROI calculator that is pretty streamlined in being able to capture that information. So, and Gayla, if you want to click through onto the next screen. All right, so from here, again, we've taken the averages of averages. We've taken the lows and we've thrown the lows out. We've taken the highs and we've thrown the highs out. What we tend to see is our customers in a workflow from our perspective, right? We call it, because of the amount of nuance across organizations in terms of integrated workflows, we look to define what a workflow is so that we could accurately estimate what you would need in terms of number of workflows to give you some transparency into the pricing process. And so we define a workflow as a series of related actions performed by a single user during a single login session. So as an example of that, an individual workflow includes registering a patient or making an appointment or checking in that appointment or rooming a patient. However, again, back to the way that we look at automation and reusability, you're going to see registering a patient in multiple workflows. So we're going to charge you independently for each of those workflows. Due to that reusability, we'll use that same workflow within each of your integrated workflows. So again, we tend to see about 350 as the average number of workflows that we leverage across the customers to give them the appropriate coverage in terms of automation. And another important factor here, we'll never say that we'll give you or we'll eliminate all manual testing. We've seen about 80% is where we land in terms of automation that we've been able to cover and eliminate manual testing activities. So that's what we use here. Gayla, if you want to move on to the next. So here, this is what we've captured around salaries and those resources that are dedicated to your testing events. And this goes into the back algorithm that allows us to then start working into the number of resources that you have dedicated to your testing events, the capacity in which they're dedicated, which will again support the ROI. All of this is adjustable, of course. So we provide this link to you and your team so that you can work through evaluating what the ROI is of SureTest. So here are the call outs of number of resources involved in each of your testing events and the capacity in which they're involved in those events. Down at the bottom, you'll see ad hoc testing. And this originally wasn't here, but we had one of our customers suggest that there has to be some benefit to the continuous testing that we perform and proactively, running end to end those tests and proactively run those test journeys. And we think that benefit, this was them saying, we think that benefit was an hour a day on average due to the various testing activities that our analysts are performing. And so we would assume that eliminates about half of that, so a half an hour a day. So we've been ultra conservative and just assuming that we're eliminating about a quarter of an hour a day of manual testing activities across your entire analyst team. Gayla, if you want to go to the next screen. So here, again, average, we've got some customers who do quarterly upgrades. We've got a lot of customers that do biannual upgrades. And so that mixture lands us at about 3 upgrades a year with testing cycles running on an average 3 weeks. Some, of course, are less, some are more. This is that ad hoc testing that we captured from the previous screen. And then there are a number of SUs would be delineated based on your major upgrade cycles. So if we were saying that there are 3 major upgrade cycles in a year, you would have 9 SUs. Typical week for SUs running about 1 week. And significant projects are things like adding a clinic, M&A, adding a new module within Epic, and today our average customer is doing maybe 1 significant project per quarter with a 2-week testing cycle. And so as you can see, it's starting to populate what the ROI is and what the cost is, what your total number of hours are across the year. Gayla, if you want to jump to the next screen. All right, so this is the what I like to call the Jerry Maguire slide, right? So it's showing you your total number of hours that we would estimate to be eliminated the cost savings. This is your gross cost savings of what what would be calculated based on the manual hours that you have committed to testing today, and then your cumulative hours over the next 5 years of manual testing versus testing with SureTest. So you've got a nice visual representation of what that looks like, and as well as a line graph. And then Gayla, if you can scroll down just a bit more to the bottom there, you can see what your net ROI would be over 3 years. So 3 years is our initial term in most cases, with also a projected 5-year savings. So it's it's $2 million from a tangible dollars perspective. What we've done, and two, just to make it a bit more convenient for anybody evaluating SureTest, this downloads into an SBAR template that is in customizable, right? So as you download it, it produces a full PowerPoint output that essentially builds the business case for you. So it's really, again, try to be really thoughtful about the way that we engage our prospects, our customers when we're looking to do workflow capture, and also not just bringing a problem to the table, bringing a solution when we identify a problem. So I know we've got a few minutes left here. I really hope that everybody's found this helpful. Ryan, Myron, I can't thank you enough for not only the partnership, but spending some time with us today to share more about the journey with Novant and deploying test automation in partnership with SureTest. Really appreciate it.
Yeah, for sure. Thanks, Phil, for inviting us. If anybody has questions after, you can reach out directly, not a problem. Also, we'll be if you're in the Carolinas, we'll be at the North Carolina user group meeting at the end of the month in Winston-Salem, North Carolina. I believe SureTest will be there as well. I think they have a booth, but a number of my analysts and I'll be there as well, and Ryan will be there. So.
Excellent. No, it's a great call out. We will be there. So Steve Dudley from our side, who's my colleague and counterpart, will be attending that in my place. And then all of these slides will be emailed to the attendees. So you all will have them. If you have any questions, don't hesitate to reach out to me, Myron, Ryan, and then we'll be more than happy to answer them for you. But hope you guys have a great Friday and enjoy your weekend. And Myron, Ryan, thanks again.
Thanks all.